Senator Koiti Omtata.
Mr. Speaker, sir, thank you for this opportunity to address the Minister of Health.
A supplementary question, not
Yes, I'm
to
asking a
address.
supplementary question by addressing her. My question is, Cabinet Secretary, conceptually speaking, how do you reconcile the concept universal health care and the practice of paying premiums? Paying premiums means that you have capacity. Universal means nobody's left behind. Paying premium means only those who are able can come on board. So how does it become universal health care when people have to pay premium to access the service? Because we are trying to invent the wheel in Kenya. There's absolutely no country in the world where universal health care is funded through premiums. It is usually funded by main taxes, and Kenya is a signatory to the Abuja Declaration of 2001. When did we move away from Abuja to SHA? That's the question I want you to answer after reconciling the conceptual, the philosophical contradiction that we are visiting upon this country by using stock phrases like universal health care. Thank you.
Senator Chalge.
Thank you, Mr. Speaker, sir, in answering. I think what the majority leader forgot is that the ministry has also left the president to be explaining the issues of SHA instead of them communicating the country even on a daily basis. So I hope you take those notes and take it seriously, that as a ministry, you must come out and explain and answer questions so that we don't leave it to the president. So, Madam Minister, we can cut some slack because you just came in, but you must pull up your socks. Finally, Mr. Speaker, sir, there is this story, Madam Minister, can you put it to rest, about Baby Ariana Wairimu? Allegations as that she had a bill of 1.6 million, but SHA only paid 23,000. What is the proportion in line of what Senator Wambua was asking in terms of payment in proportion of the bill that the hospital is using? So the case, you can use the case of Baby Ariana Wairimu, where that 23,000 only was paid against 1.6 million bill, and confirm to the nation in the same line whether all funds under SHI fund, critical care fund, and primary health care fund, are those three funds under SHA and SHIV, under Social Health Authority, functional at the moment, Madam Minister, and confirm to the country that whether these three type of funds are functional and Kenyans can access. If they are not functional, just be honest and tell us either one or two are functional. I thank you, Mr. Speaker, sir.
Senator Sifuna. And then, Honorable Senators, we must move to the next question, kindly. Senator Sifuna.
Honorable Speaker, it's not every day I stand up and say that the majority leader has spoken for me. But this is one of those days, and I've always suspected that the majority leader is a good man, because whenever we come to critical junctures where we have to close ranks and say if something is working, it's working, if it's not working, it's not working, he has always done so. And that is the conversation we've been praying for in this country. Honorable Speaker, and Madam CS, you're present here. The president, I heard him yesterday saying he pays 50,000 Kenya shillings for SHA. I very painfully pay an average of 32,000 Kenya shillings every month to SHA. And I say painfully because, Majority Leader, you will recall that when that bill was here, I proposed an amendment to cap that contribution at 5,000. Unfortunately, that time, when a Majority Leader, you are not as good as you are this morning. You allowed the you voted to defeat that amendment, Honorable Speaker. But I want to cut through the noise, because here in Nairobi, Honorable Speaker, you know they say, hatutaki mambo ya Kizungu mingi. Now that the president told us that if we remove that capping, that if all of us pay according to our abilities, we will end the specter of Harambes to raise money for healthcare in this country. Can the cabinet secretary standing here before the Senate today confirm to us that there is no family in this country that has planned a Harambe for this weekend to get payment for a loved one to obtain healthcare, including that Baby Ariana, Honorable Speaker? Can she confirm that to the country? And if she cannot confirm, then she should be gentle enough, she should be kind enough to tell us today that this thing is not working, that we should go back to the wisdom of Sifuna when we were having this conversation in this house. I thank you, Honorable Speaker.
Cabinet Secretary. Very well, Mr. Senator Methu.
Thank you very much, Speaker. In fact, I want to conceptualize the issue that has been raised by Senator Cherargei and Senator Sifuna. There's no way that the Minister and the Ministry of Health cannot say that they are not aware of the case of Baby Ariana, who I would want to confirm, Honorable Speaker, is a patient from my own county, comes from Orjorok in Nyandarua County. Baby Ariana suffered from Pearson disorder, and she is the 10th patient in the world to get that particular disorder. So there's no way the ministry would say that they are not aware of such a patient who has such a rare disorder. And the hospitals in India have actually been using her case as a success of a Pearson's disorder that has been treated. It's a genetic disorder that has been treated. Honorable Speaker, unfortunately, we lost Baby Ariana. Her bill, as it were, by the time she passed on, Honorable Speaker, was 1.6 million. What SHA has paid now is 23,000. And therefore, can't we use then this case to gauge whether SHA is working or not working? Because 23,000 out of 1.6 million is such a small and negligible percentage, Honorable Speaker. And you cannot keep leading statistics. This is what we have put as money. This is what the number of patients that have been taken care of. Give us on this very specific case that you must be aware of, because it's a very rare disorder. You must be very aware of Baby Ariana. Tell us why SHA has paid 23,000. First, confirm whether SHA has paid 23,000. And secondly, tell us why SHA can pay 23,000 out of a bill of 1.6 million.
Very well, Cabinet Secretary.
Thank you very much, Honorable Speaker, honorable members. So I will start with the question from Senator Mtata regarding the UHC premiums. So previously under NHIF, as you remember, it was tax funded, but it was really capturing the formal sector with only 20% of the population under this health insurance. And so when we talk about leaving no one behind, NHIF was not living up to it because we were not able to cover each and every Kenyan when it comes to health service delivery. So when we come to SHA, we see that it is improved, where we are trying to ensure that all Kenyans are on board and all their health needs are addressed, and part of it is through using the social health financing, ensuring that 2.75% of their amount is again being deducted for contribution into the SHA, the social health insurance. Ultimately, our goal is to ensure that we are leaving no one behind. But equally, you take note that the indigents will be covered by government. That is the people who are unable or are not capacitated well to cover or to pay the premiums. We, as again, a government, we will be able to support again in their health insurance coverage. So I think this is really a great step from the 20% and then now ensuring that all are being covered. And you can see that we have now increased, registration is now up almost 3 times the population that was covered previously. So great progress when, Senator Sifuna, as you said, there's great progress when we talk about the number of people that have been registered and the number of people that can access primary health care. We are having, up to 3 times more that can be able to access. And then when we come to registration and being able to access services in higher levels of care, we are looking to ensure that there's improved contribution. Ultimately, all Kenyans will be able to access care. So I believe that this is a game changer where we will have Kenyans not selling their property in order to access health. Additionally, there are very good stories out there, and I can attest, and maybe we will, next time we can have a documentation and reports of, more than 500,000 being able to access these services, and again tabulate how much contribution that did they have to pay and how much was NHIF covering. That way we'll have evidence-based, and data-driven analysis to show you that indeed SHA is working. And when we talk about the issue of Baby Ariana, yes, the ministry acknowledges, and indeed we send our condolences to the family. We acknowledge, again, that was a challenge. Seeing the Pearson's syndrome is really a very rare disease, and only 10 people in the whole entire world have this disease. And so as a ministry, we are looking into ways of ensuring that we are reviewing this condition, the diagnosis, the treatment, the management, etc. But when it comes to the management of the baby, when you notice that NHIF cover previously was 4,600 for ICU, but I can assure you that the ministry has really been advocating and pushing to ensure that our ECCIF, that's Emergency Chronic Critical Illness Fund, is improved. And right now, we are happy to say that after reviewing, it has been increased to 28,000 Kenya shillings, and that way gradually will improve. We have the benefits package advisory team, and this team will be reviewing the benefit package and seeing gradually how we can improve to ensure that Kenyans are accessing services. As you are well aware, at the beginning of UHC, what we looked into is the burden of disease in Kenya, and then we also looked at what was causing death and what was causing catastrophic expenditure, and also reviewing what NHIF was offering, and you can see the benefit is actually better or the same as NHIF. Nothing is lower than what NHIF was offering. But moving forward, based on the resources at hand, we hope to gradually improve the benefit package for the betterment of health services for all Kenyans.